Right from the onset, going back to that March 13-14, we started campaigning within all our clients, apart from sending flyers home in their preferred languages. We made calls to everybody again, even those who have been to the office. Please take all these precautions because of COVID.
This virus has demonstrated that in the last 10 months, that 70 million people around the world have become infected by this microscopic organism.
This virus is real, and this virus is actually affecting the brown and black community more than it's affecting most of the other ethnic groups. And so I want them to understand that we don't have to die from it if in fact we all work together and do some of the things that we've been asked to do.
Primary objectives: one is to combat the spread of COVID-19. Second is to support community basic needs. And thirdly, to support community mental health. There's a lot of people who going into this crisis were already stressed. So we wanted to equip these community health deputies to be able to help their neighbors get through this crisis as well.
In case you find any of the symptoms around you, please let us know so that we know how we can assist you. To say you keep downstairs and we keep upstairs, people do not have that because of their level of income. So it's kind of giving them information to that extent that we're here to help them and to see how we can again make use of the resources that DHS has provided if that situation should arise.
You have to be very careful right now to not really get complacent about your health conditions. It's very important for you to contact your doctor, see your doctor, realize the fact that there are telehealth visits as well that you may, very well be helped without having to go into the office, but definitely staying in touch and staying on top of your medical conditions is extremely important because, as we've stated, should you get COVID on top of those, it puts you at a much more high risk of having a bad outcome.
Something that's pretty alarming that I've noticed this year is a lot of people are getting information from unsighted sources, Instagram like screenshots, or people's Facebook statuses or Facebook message boards.
So we really have to make some sacrifices, not only for ourselves, but for our community. So what sacrifices do we make? We wear our masks. I'm tired of wearing masks too. We wear a mask, we social distance, we continue to wash our hands frequently. This is new, this is novel, this has never happened before, but I'm willing to sacrifice because I don't want to be the one that caused someone else to either end up in the hospital or end up dying. This is important.
Unless you have to go out, then stay at home. And if you have to go out, then you need to make sure you're practicing those things that we've been talking about since March.
So as much as we can, wear a mask, indoors for sure, and even outdoors if you cannot maintain physical distancing. It's really important that we wear the mask the right way, covering our nose and our mouth.
You want to observe physical distancing. You want to stay away from other people if you are symptomatic or if you've been tested and don't have a result yet.
Physical distancing is defined by either 6 feet or 2 meters of distance between two people.
Try to avoid indoor gatherings with people who don't live with you. You should have your list. You should go to a familiar grocery store where you know where everything is. And you should have a route for how you're going to get through that grocery store. You should have hand sanitizer with you. You're going to keep your mask on. And if someone around you isn't wearing a mask and you don't feel comfortable calling them or checking them on that, then you walk in the opposite direction and you wait for them to leave that space.